All right, good morning, everyone. Before I take a few of your questions, I'd like to take a moment to join Dr. Nguyen in discussing an important achievement in public health in Baltimore City. Nothing is more fundamental in a growing Baltimore City than to make sure that every family has the support that they need to raise a healthy baby, and to make sure that every family has the resources to make sure our children can continue to grow and to thrive. In 2009, Baltimore had the fourth worst infant mortality rate in the country. I was committed to change that statistic. I know that every life is precious. And when we can do things that sometimes are just common sense, but because we're not, we don't get the information out, or because the education is not as widespread, we faced losing senselessly too many infants in the city, and I knew that we could do better. We knew that in order to get a different outcome, we had to take a different approach. So we decided to roll up our sleeves, face the challenges, and in 2009, we launched Be More for Healthy Babies. It's a coordinated effort to positively impact maternal and infant health in Baltimore. The second leading cause of infant mortality is sleep-related deaths. So in 2010, the Baltimore City Health Department joined with the Family League of Baltimore, Care First, Blue Cross Blue Shield to launch the Sleep Safe campaign. This campaign will focused on combating sleep-related infant mortality, which is a big pet peeve of mine, because I was so touched by the video that I saw, that I know everyone here has seen, with moms who have lost an infant through just very simple mistakes that anyone could have made, but also anyone can correct because of poor choices around sleep patterns. So since the launch of the Be More Healthy Babies campaign, we've seen a significant decrease in infant mortality. And today, we are proud to announce that in 2014, Baltimore experienced a record low number of sleep-related infant deaths. I am so proud, and I want to thank all of you for being the feet on the ground and the ones who made this happen. Because of your hard work, you should feel incredibly proud that lives were saved, and that there are young people who will have a chance to reach their full potential because of the work that you did. So I want to thank you. And while I want to pat everybody on the back and talk about the fact that this is a fantastic achievement, we're not popping champagne yet, because there's still a lot more work to do. This is a call for further action. We know that if there's a way for us to stop one preventable infant death, we know that we have more work to do. One death is too many. So we have to do more to help all of our families have healthy babies. So today I'm announcing that we will begin the next phase of this campaign, smoke-free sleeping for babies. This initiative will focus on another leading cause of infant mortality and the very real health risk of secondhand smoke. It is very dangerous for pregnant mothers and for babies. And I want to thank particularly CVS and Care First for their continued partnership and their support. They are always willing to work with us for that next stage. What more can we do? How can we do an even better job? Yes, we're doing great, but what else can we do to get there? And we need more partners like that. So again, I'm grateful for Care First and CVS. We would not be able to make the progress that we've seen in Baltimore without their support. And I look forward to continue our great partnership to give every child born in our city the very best future possible. I'd now like to introduce Dr. Lena Nguyen to talk more about this fantastic achievement. She is just an incredible advocate for children's health and supporting our families. And again, thank you for your leadership and all of your hard work, and for your whole department, because we have I'm very proud of the work of the health department. Dr. Nguyen?
Thank you. Thank you very much, Madam Mayor, for coming today to share this really exciting news about the record low number of sleep-related infant deaths. Now, this would not be possible, none of this would be possible without your support and strong leadership every step of the way, and also our partnership with Care First on our Be More for Healthy Babies campaign. So I'd like to first recognize our partners, some of which are standing around today. You see our very large group, but even this very large group is just a small percentage of the total number of people who have contributed to making this achievement possible and making this partnership possible. So we're hugely indebted to Family League of Baltimore, Care First, Healthcare Access Maryland, the Johns Hopkins Center for Communication Programs, Mission Media, among others, because these partners are really key to our success. Now, our mayor just mentioned that, unfortunately, back in 2009, Baltimore had the 4th worst infant mortality in the country. And the reason this matters is that infant mortality is a measure of how our society takes care of the youngest and most vulnerable. It's a key public health measure of a city's health and also of a society's health disparities and inequality. Just like so many other public health issues, infant mortality is a complicated issue. And many people said at the time, and still do, that, well, this is too tough of a problem. There are too many factors involved, and we can't really make a difference. But Mayor Rawlings-Blake and our health department and our partners knew differently, because we knew that this was too important of an issue to ignore, and that we knew this is something that we can move the needle if we all work together. And so that's why over 100 public and private partners came together to form the BMO for Healthy Babies campaign so that we can work on a singular goal: to prevent babies from dying and to empower women and children to live healthier lives. And as a result, in 2012, Baltimore had the lowest infant mortality we've ever had, and the lowest infant mortality rate ever in our city's history. Today, we're here to share even more good news, which is that in Baltimore, we know that the second leading cause of infant mortality is sleep-related deaths. That's not the good news, certainly. And the second leading cause of infant mortality deaths is sleep-related. The first leading cause is related to preterm birth and low birth weight. Between 2009 and 2014, Baltimore had 102 babies die in their sleep, with a record high of 27 babies who died in 2009 alone. Almost every time, these deaths were related to an unsafe sleeping environment, which, as Mayor Rawlings-Blake mentioned, are things like a baby sleeping on their stomach, not in a crib, and with other objects around them that could suffocate a small child. And we know, and science tells us, that education is the key to changing behaviors that can prevent these tragic deaths. And that means that everyone needs to know the ABCs of safe sleep, which we have videos that are playing, that our mayor referenced, that babies shouldn't be put to sleep alone, on their backs, and in cribs. No exceptions. This is the best way for us to ensure that babies stay healthy and that are ready to thrive. Now, again, in 2009, 27 babies died in their sleep. That's 27 preventable deaths, and as our mayor said, that's even one death is one death too many. So we began an aggressive campaign, an aggressive outreach campaign that included showing videos in the hospital to every family after a baby is born, reaching families in unique places like jury duty, training over 4,000 healthcare and social service providers on the ABCs of safe sleep, engaging community members and community workers to help teach safe sleep in markets, libraries, barbershops, and door-to-door canvassing. In 2014, as a result of all of these outreach efforts, we had a record low of 13 sleep-related deaths. If this result were replicated across the country, and I know that our mayor has taken such a strong leadership role as the president of the U.S. Conference on Mayors, if this result were replicated across the country with all these other mayors that our mayor is now leading, we could save the lives of thousands of babies. Well, we're very proud of the BMO for Healthy Baby success, but we also learned that more than half of the deaths involved babies sleeping in homes where people smoke and or where the baby's mom smoked while pregnant. And that's why we're launching the next phase of the campaign to raise awareness around smoking in a pregnant woman or around a baby. Now, we have done great work, but there's a lot more to follow. And so I'd like to now introduce someone to introduce to us and to talk to us more about the great work that needs to continue. And this is someone who's been really instrumental in spearheading the BMO for Healthy Babies campaign. I mean, I feel so fortunate every day to work for a mayor who's 100% committed to public health, and also with an incredibly strong team around the city and in the health department. One of our shining stars in the health department is Rebecca Deneen, an assistant commissioner for maternal and child health. Thank you for all that you do, and I'm really pleased to introduce you today to receive accolades for your dedication and passion and hard work, and to talk more about the work ahead for Baltimore. Thank you, Rebecca.
Thank you. So good morning, everyone. Thank you, Madam Mayor, for all of your support, which has been unfailing in the last 6 years or so. And thank you, Dr. Wen, for sharing with us this very simple way we can reduce the number of deaths of babies who die during sleep, and how we can even further reduce this number by endorsing smoke-free environments for pregnant women and newborns in Baltimore. So thanks again to CVS for giving us this opportunity to kick off our new and hugely important public health campaign to reduce smoking in pregnancy and to reduce secondhand smoke exposure around pregnant women and infants. And thanks to Julie Wagner, especially, for making this connection through Care First Blue Cross Blue Shield, who connected us to CVS pharmacies. I also just want to take a brief moment and say thank you to Dr. Jenna O'Keefe from the Casey Foundation, Paula Stauffer from Johns Hopkins Center for Communication Programs, Angela Burden from Healthcare Access Maryland, Shayna Thompson from MD Quit, Shayna Thrash from MD Quit, Stacy Stevens from University of Maryland, Colleen Wilburn from the Family Tree, Laura Latta from Family League, and there's so many other people to name, but those are some of the really key people we've had working with us on our previous campaign and who are kicking off this new campaign. So as you know, all CVS stores nationwide have gone tobacco-free and are changing the retail environment around tobacco. And so congratulations to CVS for taking this enormously important step towards smoke-free environments. So our new campaign has a collective goal to reduce current smoking among pregnant women by 15% by 2020. But how are we going to do this? So our overall strategy involves intervening in all 14 CVS stores in Baltimore and in their surrounding neighborhoods. So first, we'll train CVS pharmacists to identify prescriptions and conditions that relate to tobacco use. They will ask people who are coming into the stores about their environmental tobacco smoke exposure and their individual use of tobacco. Those pharmacists will also counsel, educate, and motivate their patients to quit smoking and their loved ones to quit smoking, and they will refer patients for further consultation and services. So that's the first strategy. The second is we're going to post informational materials and signs such as these that you see here that indicate what the existing resources are in all of Baltimore City CVS stores, and they will also include tabletop, floor, and floor displays. Third, building on the strategy that Dr. Wen described through our Infant Safe Sleep campaign, will increase our citywide community awareness of the harmful effects of smoking and secondhand smoke exposure on pregnant women and infants. Our purpose is really to shift the culture of our residents, and that means recognizing that smoking around pregnant women and infants is harmful. We will do this through new educational materials and posters for all hospitals and clinics, Department of Social Service sites, WIC sites, libraries. We'll even go back to jury duty and post our posters there. We're going to hold a number of events, which we hold all throughout the last 7 years, around energizing communities around this issue. This is an issue of social justice. This is an issue people need to pay attention to. Smoking is a really important concern, and we should be energized about it in our communities and in our schools. And our young people are going to be a big, big ambassador for us on this. And then we'll hold a campaign that some of you may have already seen. It's been launched to promote smoke-free environments through social media, TV, radio ads, bus shelter, bus and metro ads. And then finally, we'll continue to train all of our providers in the city, health and social service providers, about the dangers of smoking and the resources that are available. But fundamental to all of this work is really about putting our babies alone on their backs in cribs and in smoke-free environments. What's fundamental to that is the voice of our moms and of our babies. And so getting back to those basics is where we'd like to conclude. And I have the honor of introducing to you Janelle Kellum, who will talk to us a little bit about her experience with Be More for Healthy Babies. Thank you, Janelle.
Well, most importantly, I was able to receive a portable crib for my baby from a safe sleep coordinator, and she came out to my home and showed me how to set it up, and then also taught me the importance of the ABCs of safe sleep, and then she also reminded me of the importance of keeping a smoke-free environment. So I feel like that was the biggest lesson that I learned from this program.
Thank you. Thank you. So I want to close up. First, I want to thank Janelle, and thank you for being here, and I hope you continue to share that message with other moms in our community, because I think, peer-to-peer is one of the best ways that this program has seen the results that we have. So thank you again, and I'll open it up for Be More for Healthy Babies questions, and then I'll go into the broader questions. Any questions for our mom, Dr. Nguyen, any of us, anything?
Can we get the spelling of your name?
Janelle. Last name is Kellum.
Thank you.
All right. Thank you very much.
Ladies and gentlemen.
Thank you very much.
Thank you.
Thank you.
I've already violated all this.
It's in the as they're leaving. I mean, it's tough. I remember. I know that we talked about the fact that it's like sleep deprivation, torture, and you start turning on each other, and it's so easy to forget that you need to put your baby in the crib when you get so exhausted, and it's so easy just to lay them down. But I get teary when I think about it. But those women that were in that video, they said, if I could just have that 1 second back.
Yeah.
Because it doesn't take much for your baby to slide down, and if you're tired, you don't feel a baby, and it's just, but this the whole thing around how we can just keep drilling it. So in that second where you make the decision, you say, I'd rather be exhausted for another 3 minutes than to be in mourning, because you don't get that chance back. So it's powerful. The videos are very, 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 very powerful. And I had to lecture several of my friends, especially the ones that, you see all these commercials for the cribs and the nurseries, and the luxury cribs with all of the padding and all of the bumpers and all of the this and that. And I'm just like, for what? It's cute, but it's not cute for your child, because it's not going to look good in the coffin, right? Because it doesn't take much. But so that's my own crusade.
Yeah.
That's one of the things that I'm hoping that we can take up in the Conference of Mayors and try to get more mayors to get the type of grassroots program that we have and really integrate with their partners, their Care First and their CVS, so more, other partners. So, all right, enough about my soapbox.
Mayor, we did a story based on some information that was provided to us in our request from the Maryland Transit Administration, Mass Transit Administration, on the chain of events and decisions that were made on April 27th, the morning before the kind of all hell broke loose. Were you aware of the decision that was made? First of all, were you involved in any discussion that day with the school system, or was your staff involved with an effort to perhaps stagger dismissal times?
I know that Dr. Thornton was here on that day because because of what we had been seeing on social media. We were very concerned about dismissal time. So I know that he came here, he met with members of my team. I know that while he was here, he had been communicating back and forth with his team, with school police. So there were a lot of conversations about staggering. I can't say that was a conversation specifically, but I do know that there were very real attempts to have a coordinated response to what we anticipated happening.
Would you have favored the staggered dismissal time? Did your staff favor that?
I can't really, I don't have an independent recollection, nor do, I think, a notion about staggered, to say at that moment, what I don't remember in that moment, but I can say the notion of having a staggered dismissal time is one of those things that in the future we should consider if we anticipate that type of disruption at dismissal. And I would say that, and I've said it here before, when you're making decisions in real time, you're making decisions with the information that you have in front of you, and hindsight isn't one of those things. So with the after action report, I am eager to get a better sense of not just how those decisions were made, but how to have experts weigh in on if it were to happen again, how we could have a better outcome.
And likewise, the question, another very key decisions that were made around 3 o'clock that day, right after school's dismissed, was the decisions that were made to shut down the normal bus pattern around Mondawmin, which is as former Commissioner Batts said in an interview, that's a trouble spot on a good day, because you have this confluence of students that come in there. Were you aware that buses were being diverted, shut down, stopped, rerouted around Mondawmin as those students came out of high school?
I was made aware in real time, so not that it was done, not that we did not have a discussion where I was about, should this happen. We were made aware that the bus and the subway had stopped. And we tried to get to the bottom. I remember trying to get to the bottom of it at that time, and I think the question is still existing because MTA is saying the school said it, or the school suggested it, or the police said it. The police suggested that we shut it down, and everyone is there's still some confusion about where the order came, but it definitely came from what I can tell in real time from the ground there at Mondawmin, and with the confusion and the things that were going on, it's understandable to me that someone could have made or would have made that call. Again, the after action report gives us a better insight to the ramifications of that decision.
Are you concerned that, based on what you know now and looking back on how things unfolded, that decision, I'm going to use the word trapped because it's just the clearest word, trapped students in that area when they're used to using those buses to get out of there? Right. Are you concerned that may have really exacerbated the tension?
So I'm concerned that so many young people with you would hope better home training got into the melee that they did. I can tell you that what we're talking about with the buses is just one of a series of you have a series of bad options, because when I say that, a decision was made to shut down the subways and the buses, all right, and we see what happened. Let's say they open. What happens if that melee went onto the tracks? What happened if somebody fell onto the subway tracks? You could play it out in many different ways depending on what decision you made, and it was just a bad situation. And what you can see from the tapes and what we're seeing as we're taking a look at the after action is people who were trying to do the best that they could to protect the lives of the people who were involved in this, trying to make the best decisions that they could in real time to achieve that goal. And it was not, it wasn't, you have this perfect, that there was this perfect choice that was just staring at everyone, and instead, there was a decision to close the subway. It was a bunch of, very rough choices, and either one, it's just like, any decision you make it could have gone great, and it could have, led to more challenges.
The other question I want to ask is kind of a much broader question. And the after action report you're talking about is the PERF report, am I correct? So that was announced right around the time of the termination of Anthony Batts.
No, we announced that we were doing it
and
weeks.
They met at their first meeting, I guess that, right?
Right.
Okay, but that's still underway.
Absolutely.
And that is the main after action report you are relying on, am I correct?
Yes, the main one.
Okay, so the broader question, what is now pretty clear is that you had a number of chiefs that day between the schools, Baltimore Police, MTA obviously involved because they have such an involvement at Mondawmin. Do you know now that there may be a need for a much better, like super chief, someone or some entity that is really in charge of all of that, of coordinating all of those different things?
What I would say is just like we've seen with the equipment. We're not waiting for the after action to implement to make orders for new equipment, better equipment. We're not waiting for the after action to move forward with safer vans. We're not waiting for the after action to work on improved training for our officers. And with respect to what you're talking about with that coordination between all of the different agencies, we're not waiting. I've asked the Baltimore Police Department before the school year starts to come up with a coordinated strategy on how they, the school police, the schools themselves, the MTA police, MTA, my office, the police department, how we will have a more seamless coordination and more seamless response if we're ever in this situation again.
How long will it take to complete the PERF report,
Not off the top of my head, but I can certainly get that answer for you.
And will Commissioner Bass continue to participate in that?
I don't believe so.
Okay.
Seeing the continual effects of our Freddie Gray case and now the young lady who passed away in Texas, what are your thoughts on inmates or individuals to say, who have passed away in police custody, seeing how it's affected your city and other places?
I'm not 100% what your question is.
Okay, they want to become asked, seeing how Freddie Gray, Anthony Anderson, individuals who passed away in the custody of police officers, now the young lady in Texas, your thoughts, open-ended,
Right.
about the issue that we're seeing. Not only, it's not a Baltimore issue.
No, absolutely.
It's a broad issue.
What I can say is it's definitely a national issue, and it is a national issue of trust and transparency. That's why when we've had in custody deaths in Baltimore City, I've tried to do everything in my power to go above and beyond to add independence to the review and to be redundant in the review, to add more confidence to give the public more confidence that we were leaving no stone unturned when it comes to in custody deaths. In every one that I've had as mayor, I've made it very clear from the onset, just like with Freddie Gray. I said before we even got into an investigation, I made it clear that there would be an independent investigation of every part, from the incident itself to how the incident was handled to the investigation, all of that, because I think it is very important for the public to understand that that this is happening in daylight. We're not trying to hide any part of the incident, any part of the investigation. If there are ways that we can improve any part of it, just like has happened in the past, with whether it was the tragic death of one of our own officers, I'm forgetting the name of that nightclub.
Torbett?
Yeah, Officer Torbett, but with Select. I think it was Select night, right? The shooting that happened outside of there, And when I say that, we've learned, and there were policy changes made because of the after action and the independent review, and that's why we do those things, so we can work to improve the confidence that that we're doing everything possible to ensure that this isn't we're not trying to hide anything. This is not secret. To get to the facts.
Madam Mayor, when you talk to other mayors whose police departments have gone through DOJ investigation, who have reached settlement agreements with the DOJ, what kind of feedback have you gotten? What kind of lessons have you learned about how exactly it unfolds and how it will exactly impact the police department?
It runs the gamut because you have to understand that every administration and every department is different and approaches it differently. I think you have a better chance for a positive outcome. And when I say that, I mean an efficient outcome where it's not a combative process. When you have an administration like mine that was welcoming of this review. Not every jurisdiction is welcoming of a patterns and practice review. If you have a jurisdiction that, or a police department that is resistant to the investigation, resistant to hearing about the challenges that we face, the problems that we face, resistant to making those changes, it's a different situation. I was very committed knowing that my goal is to have a better police department, to have a safer community, and to improve the relationship between the community and the police. I knew that it was important to welcome the Department of Justice in, to welcome the investigation, to welcome the opportunity to have even before that, the collaborative review process, because I will continue every single day to look for ways to strengthen the bond between the community and police, because that's the only way that we're going to have safer neighborhoods. The police can't do it by themselves. The community can't do it by themselves. And anything we can do and everything that we can do to bridge that gap so that relationship in many places can be repaired, so that relationship in some other places can be shored up and strengthened, that's how we're going to get to the Baltimore that I believe is possible, and I believe that our residents deserve.
Last question.
Mayor, in the past, I know that you've said the jury is still out on whether businesses will be impacted long term by the unrest, but I want to ask you broadly, there was some analysis of census data I saw this week that said more people last year moved out of the city than moved in. Mm-hmm. I know you have a goal of growing the city long term. Mm-hmm. So in light of that analysis and in light of what was a very wrenching event earlier this year, what makes you think that Baltimore, or what can you do to get the city back on a path of growth?
What I will say as far as the census, you know how this goes. Every time there is a census number that comes out, there's also a review process, and many times the initial number that's said is adjusted. And so while that might be the initial number, many times it's been adjusted, and we've seen growth. What I can tell you is, the Live Baltimore had a home fair right the weekend after the unrest. They had more people sign up to participate in that home fair after the unrest than before. I can tell you that we're still seeing businesses that are interested in moving into Baltimore. We're still seeing progress across our city. We're still seeing investment. So am I looking at everything through rose-colored glasses? Absolutely not. Do I know that we still have challenges? Absolutely. The recovery that our country has seen in the wake of the Great Recession, many know is a tenuous recovery. It is not strong. Many people feel that it is an unstable or insecure or vulnerable recovery. And we are particularly susceptible to that here in Baltimore in the wake of the unrest. So do we have a lot of work to do? Absolutely. But just as there are, that you can point to signs that would suggest that we will slide as far as population, I can point to things that give me optimism about the future, the economic future of our city. And that's what I'm going to work for every single day, to strengthen that, to take advantage of the assets that we have, to take advantage of the momentum that we have, and to continue to look for reasons, to continue to look for ways to give people who are here more reason to stay. Thank you.
Thank you.